Welcome to HITea with Grace, where we spill the tea on HITea. I'm thrilled to be here in sunny Las Vegas, interviewing the industry's greatest leaders on health information technology trends. So tell me, who are you and what do you do?
Hi, well, I'm Julie Schulz. I'm VP of Product at Avalon Healthcare Solutions. We are the world's first lab insights company, bringing together lab benefit management as well as analytics to turn what otherwise is a cost center for most people in terms of labs into a strategic asset.
Fantastic. And who do you work with?
So I work with both labs as well as health plans, employers, trying to really get the best of what they can get out of labs. So does that mean looking at the evidence, understanding which tests are clinically necessary, trying to find gaps in care to close those with clinical decision support, all that good stuff.
Oh, love to hear it. Such an interesting space. So tell me, what is the industry's most underrated problem right now or challenge?
Oh gosh, you're catching me like after day one of health where I was, all like bright-eyed hearing about pan-cancer detection, whole genome sequencing at birth. Right now, I'm more in the optimistic space.
So tell me then, what trends are you hearing about in the health hallways that are inspiring
Exactly,
you?
exactly. Some of these things are really promising, right? And we just don't know when they're going to become mainstream, when the evidence is going to get there. I guess that's the day two problem, right?
Oh, I know.
How do we actually then evaluate these technologies and then eventually get them into practice in a way that's sensible, actionable, equitable?
Absolutely. And what are some of the trends happening in the lab insights world?
So, what we're seeing is that, like I said, lots of shiny new stuff, but then how do we get it, actually implemented? For example, when we look at liquid biopsies in cancer, we see that even though it's a new technology, it has a lot of promise, it's in the guidelines, only 18% of patients who meet criteria are actually getting that test. And then, what's even sort of, I think, unfortunate is less than 44% of them, when they do have the test, are actually taking the drug that the test recommended. So this is why we can't just, start adopting every new shiny thing that we find in the hallways at health. We have to make sure and really, think about how they get deployed, making sure physicians have the information that they need, making sure the evidence fully supports, the clinical utility.
Fascinating. Now, my listeners love to learn about what's happening in the industry, but they also love to learn about what drives leaders like yourself. So tell me, if you could give your younger self a piece of advice, what would you tell her?
You know what? Today I'm just gonna tell her she's doing a great job. I'm not gonna add on to her worries or things she needs to be doing. She's exactly where she needs to be.
Yes.
She's doing a great job.
She's killing it.
Exactly.
Awesome. Well, thank you so much for joining us today. It was great to learn from you.
Absolutely. Thank you.